next up is our panel discussion with companies that are well past their A's and are in Uber growth mode. Polina Hanin, principal at Aequitas Partners, has kindly returned to moderate this discussion with 4 impressive market leaders. Polina, thank you again, and we're excited for the conversation. I'll let you take it away.
Well, thank you very much for having me back so soon. I hope y'all aren't sick of me just yet. But breaking that up is going to be this fantastic panel of really, really wonderful entrepreneurs that we're thrilled to have a part of this discussion to share more about their journey, particularly within really complex markets inside women's health and really inside FemTech. So for those of you who are just joining, I'm Polina Hanin. I am principal at Aequitas Partners, a firm that builds leadership teams for high growth health tech companies. And so I'm more excited to pass the microphone over to the panelists here to introduce themselves and to share with you their mission, what their company does, and a highlight of the success that they've had to date. So why don't we start off with Elizabeth, then Juan Pablo, Debra, and Melanie. Elizabeth, take us away.
Thank you, Polina, and thank you for having me. My name is Elizabeth Gazda. I'm the CEO of Embr Labs. We produce this beautiful wrist-worn device that delivers temperature sensations and can alleviate many of the symptoms of menopause, hot flashes, anxiety, and insomnia. Thank you for having me.
Hi, everyone. My name is Juan Pablo Segura. I'm one of the founders of a company called Babyscripts. Really, our goal at Babyscripts is to make prenatal and postpartum care available at any time and at any place through remote patient monitoring. We currently work with more than 75 health systems across 31 different states and remote monitor more than 200,000 women a year. So really excited to be part of this panel. Thank you so much for the invitation, and excited to share thoughts and be with everybody else.
And hi, I'm Debra Bass. I'm the US President and Chief Marketing Officer of Nuvo. Nuvo is an Israeli health tech company with very novel technology for remote pregnancy monitoring and management. And our mission is to give life a better beginning, and look forward to sharing more.
Hi, everyone. I'm Melanie Goldey. I'm the COO and CFO of Tomorrow Life Sciences. We're a fertility tech company that has created the world's first automated solution for the safe care and storage of the frozen eggs and embryos that will be used in IVF. Our mission is to really safeguard the world's most precious cells for life. Very excited to be here. Thank you so much for having me.
So excited to be doing this panel with you all. One of the things that we heard about in a previous discussion is just how large this total addressable market is, and that sometimes maybe investors don't really understand. One of the suggestions that came out of a previous panel is to make sure that you're presenting your technology in a relatable way. And because a lot of women's health, I think, can be relegated solely into the pregnancy market, I actually want to jump to Melanie and Elizabeth, who are developing tech outside of that quote unquote traditional women's health definition, and just learn from you on the tactics that you've used that other entrepreneurs on this line can learn from, on how you are demonstrating the necessity for your technology to folks who may not necessarily understand it or be able to immediately relate to it.
Yeah, I can go first. Thank you, Polina. So, it's interesting. Some of the stats that were even cited in the pitches in the previous sessions, 1 in 8 people are infertile, which means that they need some sort of assistance to have a baby. 10 to 15% of couples need to have IVF. I mean, these are pretty interesting numbers, and you're almost talking about a demographic, a community of people. And many folks that are either pursuing or thinking about an IVF procedure or even egg freezing are doing a ton of research on the drugs, the process, the clinics, the reputation of the doctor, et cetera. And what we found at Tomorrow, because we're actually the solution for the storage piece, once you've gone through that initial process, how do you maintain the safe environment for caring for those until you're ready to come back for those specimens? Most people just don't even get to that point of research because they don't know. And so there's a lot of education and awareness that needs to happen as it relates to the particular niche or the part of the journey that we're focused on. And some of the tactics that we've used really are all about the end customer, who for us is really the consumer. So our solution goes into the IVF clinics, and that's where our sort of financial relationship resides. But ultimately, we believe at Tomorrow that this needs to be driven by consumers, people who are doing those research, asking their friends, talking to other people, and finding out through stories and shared stories of patients and through those narratives to even have, oh, you know, I guess I should add this to my checklist of questions when I go into a clinic. So we've done a lot of effort around consumer marketing, partnerships and programs, and it's all focused on patient education, patient awareness. And that's done pretty well for us, I think. And I would recommend that, you know, don't just think sort of narrowly about who you're necessarily getting your revenue from in your immediate audience, but how can it be fueled or powered by the ultimate end user, who again is consumer for us. So that's kind of what's worked to date for us, and we're going to try to keep coming to events like this and working with other folks in the industry, because I think women's health, fertility, tech, all of this, there's a place for partnerships and people who want to support one another. And I do think that it's these types of things where you really can amplify what you're doing in such a way that it's interesting and people are like, oh, aha, that's so interesting. And that's kind of the way that we found that it just spreads.
Thanks, Melanie. Elizabeth, the same question.
Yeah, you know, when you start to talk to male investors about menopause, it's not very sexy. But it is a massive market. There will be 1.1 billion women in menopause by 2025. And what's really interesting about women in menopause, we call them primetime women, is they have a huge share of wallet and a lot of influence on family buying behavior and key financial decisions. So we start with kind of the narrative of the total addressable market. And maybe if the eyes are not locking with us, we then start with a comparative to the male health space. So then it's very surprising for male investors to learn that this space is 4 times the market size of the top 4 male issues. So erectile dysfunction, male pattern baldness, low testosterone, prostate cancer. So 4 times the combination of that. But still, we may not get the interest. And then I think it really comes down to making the experience of a woman relatable to a man. And we do that by having the men in the room understand that a menopausal hot flash is really an overactivation of the sympathetic nervous system, which is your fight or flight response. And so we ask them to imagine the last time they sped through a red light by accident and had a near miss accident. And we asked them, you know, what happened in your body? And they described, you know, heat coming up through their body, tingling in their extremities and a sense of panic. And then we're able to say, that's what a hot flash feels like. Now imagine having 10 to 20 a day for a decade. You know, do you think that's a problem? And it's really been that analogy that has helped broaden the discussion around the challenge that women face in menopause.
All about that relatability. Thank you for sharing that tactic. There was a comment that was made in the chat about sharing stories. So I think Melanie, Elizabeth, both of you have just spoken to exactly that. Juan, Pablo, and Debra, coming over to you both, because your companies are focusing on pregnancy, a part of life that is not always as elective as a hip or a knee replacement, and therefore can't really be stopped during a pandemic. And more importantly, it's a vulnerable time for any woman who's going through it, either for the first time or not the first time. How has COVID impacted the growth of your business? And even curious about how it has impacted the conversations that you're having with providers and hospital systems and insurers. Juan Pablo, over to you first, and followed by Debra.
No, I was going to let Debra go first. We're such good friends, so but no, I mean, a couple of things just in terms of what we've seen in our market, right? So first of all, pre-COVID, there was already a crisis in maternity care and access. So 50% of counties in this country don't have a practicing OBGYN. So you already were starting in a very negative place. And then obviously with COVID, it just got even harder to receive the necessary amount of care because of social distancing, fear, all these other things, kind of spread of the virus. So, I think COVID, did two things to our industry. While obviously really negative in that it made things harder, it also changed perspectives. And I think Debra would probably attest to this. When we go in and try to sell our services, to an OBGYN practice, before COVID, there was, and you have to kind of dig into how healthcare decisions are made. Most things are made by consensus, right? So when you go and sell something, you need a whole practice or a whole group to say yes. If you have one person that says no, the whole deal is completely falls on itself, because there can be holdouts that essentially scuttle what you're trying to accomplish. And so I think what COVID did is it changed it eliminated basically that holdout physician that didn't want to change or didn't want to adopt new things. And it made it just necessary to start using digital, virtual, mobile health. Our business, we grew 10 times in COVID in terms of enrollments, utilization of our experiences for remote patient monitoring. But again, I think some great things are to stay. And that's obviously kind of a more digital first mentality. And again, it was hard before, and it's definitely improved.
So I would build on that. Everyone talks about COVID as an accelerant for telehealth adoption broadly. And I would say in pregnancy telehealth, it's been a forcing mechanism for adoption, because like you set up, Polina, pregnant women could not go unchecked. I can't delay my pregnancy for 6 months, one in episode, like I could my knee replacement surgery. So we see customers of ours like Axia Women's Health, who literally had to stand up a telehealth platform in a week to ensure care continuity of their patients. So for me, what's changed is it really debunked a lot of the inertia and resistance, like Juan Pablo talked about, right? OB is a very risk-averse specialty because of med malpractice, right? So there's a lot of risk aversion. But what we've seen is a lot of that inertia has now been debunked, and there's more appetite for deeper pregnancy telehealth. So in a Nuvo world, there's more hunger for our solution because providers see the value, and for patients, there's no turning back, right? Our whole lives are omnichannel everything. Why in 2021 is maternity care almost 100% bricks and mortar? Like unacceptable? So now that women have seen more choices, there's no going back, and we're seeing heightened demand. And there's one last sort of little news flash, and this is news for you, Juan Pablo, and we'll set up some of our conversations as well. We see ourselves as potential partners in this ecosystem. Nuvo received a second clearance from the FDA last Friday to offer NSTs remotely, which really rounds out our product offering. So we sort of got out there in the height of COVID with the start of our product, but really now have the flagship element to continue to drive our momentum.
That is
That's
amazing.
huge, by the way, for everyone. That's huge. So congratulations, Debra.
Thank you. We're excited.
Yeah, clearances are not easy to come by. So this is a really, really impactful. Actually, on a little bit on that note, and then I kind of want to throw this question openly to the panel. There was a comment that came in earlier, and we were going to talk about it later, but I'll throw it up now, is how are you all thinking about addressing the needs of access and making sure that you're also taking a look at the needs of women of color, those who may be subject to those social determinants of health that we really started to pay attention to only quite recently as an industry wholeheartedly, and thinking about access for women who are under Medicaid or who may not have that traditional access to technology. How are you all addressing that within your organizations? Elizabeth, maybe to you first.
Yeah, we're a little bit early on this as a company, but through the pandemic, we really worked to make our technology available to women undergoing cancer treatment and also women who were frontline workers. And so we saw during the pandemic that nurses who might otherwise not be able to afford the product were under PPE and not able to control their temperature. This was a very real problem for them. So we actually donated through a partner in local Boston hospitals, a couple hundred of our devices to nurses so they could have access to the technology. As we release our second generation product, we will be working on a trade-in program whereby the new product can be purchased and the prior product can be mailed in and donated to people who need it, who don't normally have access.
Juan Pablo, you guys published an entire playbook on this topic, didn't you? Yeah. So, not to do a company plug or anything, get babyscripts.com, download our white paper. It's singularly focused on Medicaid. And I mean, I know a lot of people here know that, 50% of pregnancies in this country are paid for by Medicaid, right? So obviously, I don't think you should even try to build a product in pregnancy without directly addressing, obviously patients that, have certain challenges and risks, right? So, from our perspective, what we did, and it was pretty existential and fundamental to just what we believe, is patients cannot and will not pay for Babyscripts. That's like rule number one. So, we thought about direct to consumer, a lot of investors, and I will wholeheartedly agree. And, as a man, I will acknowledge that there is a massive bias against investing in women's healthcare. And, I think, everyone will tell you what you should do as a founder in this space. And, again, I have to be very sensitive because I'm a man, but, they don't know the challenges. And I'm always very humbled by like the conversations that we have with our patients. So, number one, it's making sure that, patients never pay for Babyscripts. It's sponsored by either a provider organization or, ultimately it should be the payer, since obviously there's so much kind of cost and complications in the space. And then, I think you have to specifically build products for this patient population. I do think in FemTech and just in digital health in general, there's definitely been a change in conversation, which is good, not being scared of Medicaid, but embracing Medicaid. But if you as a founder don't directly try to build products that are accessible, that are culturally competent and specific, then you will not make a dent in really the biggest challenges in this patient population and in our space. So
I'm going to give another flavor of expanding access, because there's obviously the underserved. The other are the 10 million women in America that have no access to an OB because they live in rural or geographically difficult locations. So one example is if you think about the state of Hawaii, and there on the main island, you could have an OB or maternal fetal medicine specialist. But if you happen to live in one of the smaller islands, there's only a nurse midwife. And if you have a complication today, they send a chopper to bring you to the main island. So Nuvo's looking at models also in some of those geographic locations where there are no OBs, maternity deserts, to provide new models of care and opportunities to triage, because everyone should have the gold standard of care regardless of where you live.
Melanie, for you guys, how are you thinking about it? Because I think typically IVF and egg freezing is seen as a luxury, right? It's not always covered under insurance.
Yeah.
How are you guys thinking about access?
Yeah, so it's early for us. We just commercially launched in January, which has gone really well and it's exciting, but it's a little early in terms of our efforts here, although it is primary to our mission of overall trying to increase access and ultimately drive down price, particularly as it relates to IVF, because it is economically divisive. And particularly in the US, where you're absolutely right, Polina, insurance doesn't really cover it, and only in certain cases to a certain extent. And for our piece, the cryo storage piece, usually that's 1 year, if anything, and then the patient's sort of on their own. So there's already a number of barriers there that we're trying to break down. Philosophically, I believe that, and only through technology and innovation can we drive prices down. That's a sort of a general statement, and we've seen that happen in other industries. And so we are working on some partnerships with other ecosystem players to think about that IVF journey and how can we bring automation to the lab to ultimately be able to drive down the cost of a cycle. We also have in development a payer strategy, so thinking through how do we work with insurance companies to provide more coverage to increasing numbers of communities by showing that sort of the storage and the safety of our solution can actually create a better environment for potentially better outcomes, which they should like. So that's kind of the idea there. And then working with employers. I think that generally you're seeing a lot of big corporations and companies and even startups thinking about the rewards that they give their employees. And that is not, divisive. That's really inclusive of like, hey, we're going to choose to spend our company dollars by subsidizing the cost of fertility services. And I love all of that. So thinking about who we can partner with there. One thing that we have announced, which is great, is we're working with an organization called Chick Mission, who you should look up, a women-led organization, nonprofit, focused on providing scholarships to undergo IVF. Or egg freezing. And this is for cancer patients who are undergoing chemotherapy or radiation that can unfortunately potentially render them infertile. And so this is a proactive measure that shockingly insurance does not cover. And so Tomorrow has partnered with them to provide free storage for life for their scholarship recipients.
That's amazing. Melanie, you bring up actually a really interesting point about the notion of partnerships. And I think in healthcare is uniquely a collaboration, partnership-led industry. But maybe even in this particular sector, it is something that is truly necessary too. So to pick up on that, JP, Debra, how do you guys view, collaboration within this space? How necessary is it really?
So from my perspective, leaning into the metaphor of it takes a village, I believe no one has all the answers. And the only way that we're going to deal with these intractable problems is through collaboration. And one example with Babyscripts and Nuvo is Babyscripts is ahead in the journey commercially, has really mastered workflow integration as complementary technology. There's an opportunity to better serve women, providers, payers together. I would say the challenge in startups when you try to get a couple startups to partner is we often get distracted with our own tyranny of the urgent, right? So I think there's huge opportunity. And I think part of the challenge that we need to wrestle through is how to really make it a priority and get going together.
Yeah, I completely agree on how many distractions there are in the product roadmap, right? And a partnership requires courage because obviously there's so many things that current customers are asking for. But I do think there are things that all of us can do, from the get-go, like trying to build your platform for a little bit more scale, like to start. So obviously we're all so focused on just making money quickly to obviously raise that next big round. But if you do make some more investments up front, I think it will really benefit you later down the road. And if you just look at pregnancy, no one company can do it all. It's just impossible. There's like so many different software and hardware needs in this space. Like, you know, Nuvo has probably one of the most sophisticated hardware applications in the space, but you know, obviously there's so much more that needs to happen down and upstream, that I think pregnancy is a great place to collaborate. But again, you have to have a little bit of foresight, and that's what I would kind of encourage other, you know, either earlier stage or about to happen entrepreneurs.
Elizabeth, you guys are in, I think, over 100 countries, if I am not mistaken, right? What do the folks in the US not know about women's health outside of the US?
Well, I would say, first of all, that we only sell in the United States from one website. So it's pretty remarkable that people abroad buy the product, ship it someplace in the United States, and then ship it abroad again and pay customs on it. And I think this just speaks to the tremendous problem that women in menopause are facing. And if there's a solution that works, they will find it. But to answer your question about what maybe is holding things up in the United States, perhaps it's the fact that menopause today in the United States is defined as a genitourinary disease. It is not seen as a natural state of a woman's life. It is actually defined by the medical industry and coded as such by the insurance industry as a disease. And I think until we change that, we're going to be fighting an uphill battle.
I think that is a really interesting call to action for all of us within the industry, but also to start to think about how we can start to really expand the definition of women's health and FemTech. And I think between Elizabeth, what you're doing, and Melanie, for you on the supply chain side of the equation, and Juan, Pablo, and Elizabeth with everything that you're doing for expectant moms, there's so much collaboration to be had and so much inspiration for all the entrepreneurs here, as well as the investors and potential partners for you all. So with that, I think that is our time, and I'll pass it back over to Susan for the next group of presenters. Thank you all so much.
Thank you, Polina. Thank you, Susan.
Thank you.
Thank you. Thank you, Polina, Liz, Juan, Pablo, Debra, and Melanie. I have to tell you, I just needed this conversation today. It was just amazing. So you're all setting the stage for so many women's health companies to follow, and it's really a privilege to hear your stories and your success. So congratulations to each of you.